A baby's due date is calculated from the end of a mother's menstrual cycle, and we generally talk about pregnancy as being 40 weeks of gestation. Preterm babies are babies that are 3 to 6 or more weeks early ahead of that calculated due date. Babies need their time for development in the womb, and even a baby that's 2 weeks early, if it doesn't come on its own, if it's scheduled early, or if there's an illness or there's an event, a trauma or something that brings the baby early, it's a lot like taking your cake out of the oven even 5 minutes early or 10 minutes early. It's not completely ready to be here. Babies that are in the 3 to 6 week early phase, they often have some complications in getting their normal breathing occurring. They have fluid in their lungs that it's hard for them to work out, which then predisposes them to infection. Their immune systems are not well developed, so any little bit of infection can just spread through a baby's body really, really quickly. Preterm babies also have a hard time maintaining their body temperature. They can't keep themselves warm if they get cold. They can't cool themselves off if they get hot. The stomach of a preterm baby is very, very small, and babies under, we generally say babies under 5 pounds, they have to use more calories to suck in the milk than what their stomach can hold. This means that they're burning calories and losing weight as they're breastfeeding, as they're taking in their nourishment. So they often need some kind of artificial assistance in order to gain weight, to grow in their early times. They're not born with the reserves that a baby puts on in the last 3 weeks of pregnancy, so they don't have the extra body fat, they don't have they're just not as ready to be here. We should be very careful about how we pre-plan our needed cesarean births, or there are other induction processes that are being used in the hospital now by medical obstetricians, and it's very important that the accurate due date and the full length of term for the baby be taken into account for the baby's well-being.